Why did my scan come back negative when I have pain? It's a big question patients have. They don't often get answers that satisfy them, but it's still a prevalent thing. And this is kind of a complex thing to answer, so I'm going to start by annoying everybody. A lot of technology has made doctors stupider. Doctors from the 1980s and 90s had much better clinical skills than some of our doctors right now. And the result is because of all this technology. So we have technology, it gives you a report, people learn to get access to technology, someone reads the report for them and they act accordingly. Why do you have pain but have a negative scan? Because a scan, or an MRI, or a CT, or an X-ray only looks at a particular part of what's going on. It doesn't integrate the entire thing. You need an actual doctor who understands the musculoskeletal system to link all that together for you to make a proper diagnosis. And I'm going to expand this a little bit more. Same question again. If the scan is negative, why should a person have pain? So the most common reason for a scan will be a person who has a back pain shooting down into their leg, or a neck pain that shoots into their arm. So what's the value of an MRI scan? The MRI scan will tell you if you should get surgery or not. Now, the tricky part to that is most cases actually don't unless they match a specific clinical criteria. If they match a specific clinical criteria where the muscles are actually weak, the reflexes are lost, and there's pain at a particular level, then that's a person where if the scan is also positive, they qualify for a surgery. Now, many people have pain that shoots down one area and they have weakness, but it can actually be due to the pain that they're having that makes the muscle weak and not an actual nerve damage. So how do you separate these things out? And then what's actually causing it? When you have all those clinical features positive and the scan positive, you'll likely find that the disc is bulging and it's irritating the nerve root, and getting it cut out and fusing that area can be a very good thing to do. If the scan is negative, what's the cause? That nerve that manifests as reads pain and sensations from here starts here, so it runs all the way throughout the body to get to this region, and anywhere along its path it can get trapped. So if it gets trapped in the myofascial planes or in just the fascia, it can now generate a pain signal that manifests in that region. But it's still just a local entrapment of the same structures. This is why people have pains that the scans can't pick up. And this is why you need a doctor trained in musculoskeletal medicine to identify these things for you. Because no amount of physical therapy, dry needling, tablets, or injections will fix that if we can't get a proper diagnosis first.